The birthday cake sat untouched on the kitchen counter, its 34 candles slowly melting into colorful puddles of wax. Kate Matthews stared at her reflection in the darkened window, her fingers unconsciously tracing the thin scar that ran along her collarbone, a reminder of battles fought in sterile hospital rooms and the victory she never thought she'd live to celebrate. For months, the world had wondered where she had gone. Social media posts stopped appearing. Phone calls went unanswered. Friends received polite but distant responses about taking time for herself. But tonight, on her birthday, Kate was ready to break the silence that had protected her through the darkest chapter of her life. What started as a routine checkup had become a 2-year journey through cancer, chemotherapy, and the kind of fear that changes everything you thought you knew about yourself. Now, as she prepared to share her story, Kate realized that surviving cancer wasn't just about beating a disease, it was about discovering who you become when everything familiar is stripped away. This is the story of a woman who chose silence to find her voice, who lost everything to discover what truly mattered, and who learned that sometimes the greatest gift you can give yourself is the truth, even when it's terrifying to share. Kate Matthews had always been the type of person who planned everything down to the smallest detail. Her calendar was color-coded, her meals were planned a week in advance, and she had a 5-year career plan that she reviewed every 6 months. At 32, she was a successful marketing director at a tech company in Denver, owned a beautiful townhouse with mountain views, and was in what she thought was a stable relationship with David, a lawyer she had been dating for 3 years. The morning of March 15th started like any other Tuesday. Kate woke up at 5:30, went for her usual 3-mile run through the neighborhood, showered, and prepared her overnight oats with fresh berries. She had scheduled her annual physical for 7:45, squeezing it in before her 9 o'clock meeting with potential new clients. It was supposed to be routine, blood work, basic checks, maybe a lecture about getting more sleep. Dr. Sarah Chen had been Kate's physician for 6 years. They had developed an easy rapport, with Dr. Chen often joking about Kate's obsessive scheduling and Kate appreciating the doctor's straightforward approach to medicine. When Kate mentioned she had been feeling more tired than usual and noticed some unusual lumps in her neck, Dr. Chen's expression shifted slightly, but Kate didn't think much of it at the time. The examination room felt colder than usual as Dr. Chen carefully felt along Kate's neck and throat. Her touch was gentle but methodical, and Kate noticed the way the doctor's eyebrows drew together in concentration. When Dr. Chen asked Kate to lie down for a more thorough examination, checking her abdomen and lymph nodes, Kate still assumed it was standard procedure. After the examination, Dr. Chen sat down on her rolling stool and looked directly at Kate. There was something different in her expression, a seriousness that Kate had never seen before. Dr. Chen explained that she felt several enlarged lymph nodes and wanted to run some additional tests. She used words like precautionary and probably nothing, but Kate could sense the underlying concern in her voice. The blood draw took longer than usual, with multiple vials being filled and labeled. Kate watched the deep red liquid flow through the tubing, wondering why they needed so much. The nurse, usually chatty and warm, was unusually quiet as she worked. When Kate asked if everything was okay, the nurse gave her a reassuring smile that didn't quite reach her eyes and said the results would be available in a few days. Kate left the medical center feeling unsettled but tried to push the worry from her mind. She had important presentations to prepare, deadlines to meet, and a weekend trip to plan with David. She threw herself into work with even more intensity than usual, staying late at the office and checking emails until midnight. When David asked if she wanted to talk about the doctor's appointment, she brushed off his concerns and changed the subject to their upcoming vacation plans. 3 days later, Kate was in the middle of leading a brainstorming session when her phone rang. She normally would have let it go to voicemail, but something made her glance at the screen. It was Dr. Chen's office. Kate felt her stomach drop, but she excused herself and stepped into the hallway to take the call. Dr. Chen's voice was calm but serious as she asked Kate to come in that afternoon to discuss her test results. When Kate pressed for more information, the doctor gently insisted that it would be better to talk in person. Kate's hands were shaking as she hung up the phone, and she realized she had been holding her breath. The afternoon appointment felt surreal. Kate sat in the same examination room where she had been just a few days earlier, but everything looked different somehow. The motivational posters on the walls seemed fake and cheerful, and the smell of antiseptic made her feel nauseous. David had offered to come with her, but Kate had insisted she could handle it alone. Now, sitting in the uncomfortable plastic chair, she wished she had accepted his offer. When Dr. Chen entered the room carrying a thick folder, Kate knew immediately that her life was about to change. The doctor sat down across from her and began explaining the test results in careful, measured words. Kate heard phrases like abnormal cells, additional testing needed, and oncology referral, but her mind seemed to be operating in slow motion. The word cancer hung in the air between them like a physical presence. Dr. Chen explained that the initial tests suggested a form of lymphoma, but more specific testing would be needed to determine the exact type and stage. Kate found herself staring at a spot on the wall behind Dr. Chen's head, focusing on a tiny chip in the paint while trying to process what she was hearing. Dr. Chen continued talking about next steps, specialist appointments, and treatment options, but Kate felt like she was underwater. Everything sounded muffled and distant. She nodded at appropriate moments and took the referral papers that Dr. Chen handed her, but her hands felt disconnected from her body. When Kate finally made it back to her car in the medical center parking lot, she sat behind the wheel for 20 minutes without starting the engine. She stared at the referral papers in her hands, at the word oncology printed in neat, professional letters. This was not part of her plan. Cancer was something that happened to other people, older people, people who had family histories or risk factors. Kate exercised regularly, ate well, had never smoked, and rarely drank alcohol. This couldn't be happening to her. The drive home was a blur of traffic lights and familiar streets that suddenly seemed foreign. Kate found herself taking the long way, driving past the park where she ran every morning, past the coffee shop where she bought her daily latte, past all the ordinary places that made up her ordinary life. She wondered if any of those ordinary things would matter anymore. When she finally pulled into her driveway, Kate sat in her car for another 10 minutes before going inside. She could see David's car parked in front of the house, which meant he had left work early to wait for her. Through the front window, she could see him pacing in the living room, probably checking his phone every few minutes for updates. Kate took a deep breath and gathered the referral papers, her purse, and what was left of her composure. As she walked up the front steps, she realized that this was the last moment of her old life, the last few seconds before she had to say the words out loud and make it real. She paused with her hand on the door handle, looking up at the mountains in the distance, at the sky that was turning the soft pink color of early evening. When she opened the front door, David was there immediately, searching her face for clues. Kate looked at him, this man she had planned to maybe marry someday, this man who knew her coffee order and her favorite movies and the way she liked to arrange the throw pillows on the couch, and realized that everything between them was about to change too. She handed him the referral papers without saying anything. David's face went through a series of expressions as he read: confusion, shock, fear, and, finally, a determined kind of love that Kate had never seen before. When he looked up at her, his eyes were bright with unshed tears, but his voice was steady when he said they would figure this out together. That night, Kate lay awake staring at the ceiling while David slept fitfully beside her. She thought about all the plans she had made, all the things she had assumed would happen in her future. The promotion she was working toward, the house she wanted to buy in 5 years, the children she had always assumed she would have someday. All of those certainties felt impossibly distant now, replaced by a series of question marks that stretched out ahead of her like a path through dark woods. She thought about her parents, living comfortably in retirement in Arizona, and wondered how she would tell them. She thought about her younger sister Emma, who was getting married in 6 months and had asked Kate to be her maid of honor. She thought about her colleagues at work, her friends, her routine, and all the ordinary complications of life that suddenly seemed both incredibly important and completely meaningless. As the night wore on, Kate began to understand that the person who had walked into Dr. Chen's office that afternoon was gone forever. In her place was someone new, someone who would have to learn how to live with uncertainty, how to make decisions without knowing what the future held, how to be brave when everything felt terrifying. The referral appointment was scheduled for the following Thursday, which meant Kate had 6 days to exist in the strange limbo between diagnosis and treatment, between her old life and whatever came next. She decided not to tell anyone else yet, not until she knew more about what she was facing. David respected her decision, though she could see the strain of keeping such enormous news to himself. Kate continued going to work, attending meetings, and responding to emails, but everything felt like she was acting in a play. Her colleagues noticed she seemed distracted, but she blamed it on stress about an upcoming product launch. She found herself studying people's faces, wondering if they could somehow sense that something fundamental had changed about her, if her fear and uncertainty were visible in ways she couldn't control. The weekend before her oncology appointment, Kate and David drove up to the mountains for what was supposed to be a romantic getaway. They had reserved a cabin near a lake, planning to hike and relax and enjoy the early spring weather. Instead, Kate found herself obsessed with researching lymphoma on her phone, reading survival statistics and treatment protocols until David gently took the device away from her and suggested they go for a walk. The mountain air was crisp and clean, and Kate tried to focus on the immediate sensations of walking, breathing, and being alive in this moment. She noticed things she normally would have missed: the way the afternoon light filtered through the pine trees, the sound of water moving over rocks in a nearby stream, the feel of David's hand in hers as they walked along the trail. That evening, sitting by the fire in their cabin, Kate finally allowed herself to cry. All the fear and anger and sadness she had been holding in for a week came pouring out in great, gasping sobs that seemed to come from somewhere deep in her chest. David held her and let her cry without trying to fix anything or offer false reassurances, and Kate was grateful for his presence and his silence. When she was finally empty of tears, Kate felt something shift inside her. The fear was still there, and the uncertainty, but there was something else now too, a kind of fierce determination that surprised her with its strength. Whatever she was facing, she would face it with everything she had. She would learn what she needed to learn, make the decisions she needed to make, and fight as hard as she needed to fight. As she fell asleep that night in the unfamiliar bed, with David's arm around her and the sound of wind in the trees outside, Kate realized that her old life was truly over. But maybe, just maybe, whatever came next might be worth fighting for. The oncology center was nothing like Kate had expected. Instead of the sterile, depressing environment she had imagined, the waiting room was filled with natural light and comfortable furniture. There were plants everywhere, and soft music played in the background. Children's artwork covered one wall, with colorful drawings and handwritten thank you notes to the medical staff. Despite the pleasant atmosphere, Kate's hands were shaking as she filled out the intake forms. David sat beside her, occasionally reaching over to squeeze her hand or help her remember a date from her medical history. They had spent the previous evening researching Dr. Rebecca Martinez, the oncologist Dr. Chen had referred them to. Her credentials were impressive, and the online reviews were overwhelmingly positive, but Kate still felt like she was walking into the unknown. When a nurse called Kate's name, she and David followed her down a hallway lined with photographs of patients ringing a large brass bell. The nurse explained that patients rang the bell when they completed their treatment, and Kate found herself wondering if she would ever be one of those people in the photographs, smiling and holding balloons while their families cheered. Dr. Martinez was younger than Kate had expected, probably in her early 40s, with kind eyes and an easy manner that immediately put Kate at ease. She took time to explain everything clearly, using simple language and drawing diagrams when necessary. The additional tests she ordered, a PET scan, bone marrow biopsy, and more detailed blood work, would help determine exactly what type of lymphoma Kate had and how advanced it was. The next 2 weeks were a whirlwind of medical appointments and waiting for results. Kate tried to maintain some normalcy at work, but found it increasingly difficult to concentrate on marketing campaigns and client presentations when her mind was constantly focused on cell counts and staging systems. She had still not told anyone except David about her diagnosis, which meant she had to smile and make small talk when colleagues asked about her frequent doctor's appointments. The PET scan was surprisingly comfortable, though the preparation was strange. Kate had to fast beforehand and then drink a glucose solution that would light up any cancer cells in her body. As she lay still in the machine for what felt like hours, she tried not to think about what the images might show. The technician was friendly but couldn't discuss the results, which left Kate feeling frustrated and anxious. The bone marrow biopsy was more challenging. Despite local anesthesia, Kate felt pressure and discomfort as the needle was inserted into her hip bone. David held her hand throughout the procedure, and she focused on his face while trying to breathe through the pain. The sample would show whether the cancer had spread to her bone marrow, which would significantly impact her treatment options. While waiting for all the test results to come back, Kate began to notice changes in her relationship with David. He was being incredibly supportive, driving her to appointments and researching treatment centers, but she could see the strain in his eyes. He had always been someone who solved problems with logic and planning, and cancer was a problem that couldn't be solved with spreadsheets or legal briefs. They had difficult conversations about practical matters that Kate had never considered before. Did she need to write a will? Should she look into disability insurance? What would happen to her job if she needed extended time off for treatment? These discussions felt surreal, like they were planning someone else's life rather than their own. Kate also began to understand how cancer affects not just the patient but everyone around them. Her normally organized life became chaotic, with medical appointments taking priority over everything else. She canceled a girls' weekend trip without explanation, missed her nephew's birthday party, and had to delegate important projects at work. The ripple effects of her diagnosis were touching every aspect of her carefully constructed life. When Dr. Martinez called with the complete test results, Kate was at work, sitting in her office reviewing a client proposal. The doctor's voice was calm and professional as she delivered the news. Kate had stage 2 non-Hodgkin lymphoma, specifically a type called diffuse large B-cell lymphoma. While the word cancer still sent a chill down Kate's spine, Dr. Martinez explained that this type was highly treatable, especially when caught at stage 2. The treatment plan would involve 6 cycles of chemotherapy, with each cycle lasting 3 weeks. Dr. Martinez explained the specific drug combination they would use, the potential side effects, and the expected timeline. Kate frantically scribbled notes while trying to process the information, asking the doctor to repeat certain details and spell out medication names. After hanging up the phone, Kate sat in her office chair feeling overwhelmed by the mixture of relief and terror. Relief that her cancer was treatable and hadn't spread extensively, terror about what 6 months of chemotherapy would do to her body and her life. She looked around her office at the marketing awards on her walls, the family photos on her desk, and the stack of projects waiting for her attention, and wondered how any of it would fit into her new reality. That evening, Kate and David sat down to make plans. They researched the specific type of lymphoma Kate had been diagnosed with, reading survivor stories and medical journals until their eyes burned. They learned about response rates and survival statistics, about clinical trials and experimental treatments. The information was both encouraging and overwhelming, giving them hope while also highlighting the uncertainty ahead. Kate finally decided it was time to tell her family. The phone call to her parents was one of the most difficult conversations of her life. Her mother immediately started crying, while her father asked rapid-fire questions about doctors and treatment plans. They wanted to fly to Denver immediately, but Kate asked them to wait until her treatment started and she had a better sense of what kind of support she would need. Telling Emma was even harder. Her younger sister was deep in wedding planning mode, calling Kate daily with updates about flowers and venues and dress fittings. When Kate broke the news, Emma's first response was to offer to postpone the wedding, which Kate immediately refused to consider. They argued about it for 20 minutes, with Emma insisting that a wedding didn't matter compared to Kate's health, and Kate insisting that life needed to continue moving forward for everyone. The conversation with her boss, Jennifer, was surprisingly positive. The company had excellent health insurance and a generous sick leave policy, and Jennifer assured Kate that her job would be protected while she underwent treatment. They discussed the possibility of working from home during chemotherapy and arranging for Kate's responsibilities to be covered by her team members. Kate's colleagues responded with an outpouring of support that took her by surprise. People she barely knew outside of work sent flowers and offered to help with errands. Her assistant, Maria, immediately began researching meal delivery services and housecleaning companies. The marketing team organized a schedule so that someone would drive Kate to her chemotherapy appointments if David wasn't available. As Kate's first chemotherapy session approached, she found herself swinging between confidence and panic. Some days she felt strong and optimistic, ready to fight the cancer with everything she had. Other days she was paralyzed by fear, imagining worst-case scenarios and wondering if she was strong enough to handle what was coming. Dr. Martinez had prepared Kate for the common side effects of chemotherapy: nausea, fatigue, hair loss, and increased susceptibility to infection. But Kate was most anxious about the unknown effects, the ways that cancer and treatment might change her that couldn't be predicted or prevented. She worried about how the medications would affect her mind, her personality, her relationships. The night before her first chemotherapy session, Kate couldn't sleep. She wandered around her house, looking at everything with new eyes. The comfortable furniture she and David had chosen together, the kitchen where she had cooked countless meals, the bedroom where they had made plans for their future. She wondered how much of her old life would still be there when treatment was over. David found her sitting in their backyard at 2 a.m, wrapped in a blanket and staring up at the stars. He sat down beside her without saying anything, and they sat in comfortable silence for a while. Finally, Kate spoke about her fears, not just about dying, but about becoming someone different, about losing pieces of herself that she might never get back. David listened without trying to fix or minimize her concerns. He acknowledged that everything was about to change, that there would probably be difficult times ahead, but he reminded her that she was stronger than she knew. He talked about the Kate he had fallen in love with, her determination, her kindness, her ability to find humor even in stressful situations, and said he believed those qualities would get her through whatever came next. As they sat together under the vast Colorado sky, Kate felt something settle inside her. Tomorrow would bring the first step in a journey she never wanted to take, through a landscape she couldn't map in advance. But she wouldn't be traveling alone, and she was beginning to understand that courage wasn't about not being afraid, it was about moving forward despite the fear. The morning of her first chemotherapy session dawned bright and clear. Kate woke up early and went for a run, wanting to feel strong and healthy for what might be the last time in a while. She took a long shower, carefully washed her hair knowing it would start falling out soon, and chose an outfit that made her feel confident and comfortable. David had taken the day off work to be with her, and they drove to the cancer center in relative silence, both lost in their own thoughts. Kate watched the familiar streets of her neighborhood pass by the window, noting the spring flowers beginning to bloom in people's yards, the joggers and dog walkers starting their daily routines. Life was continuing normally for everyone else, while her own life was about to take a dramatic turn. At the cancer center, they were directed to the infusion area, a large room filled with comfortable reclining chairs arranged in rows. Each chair had its own four-stand and was positioned near a window, giving patients something to look at during their long treatment sessions. Kate was surprised to see how many other people were there, all at different stages of their own cancer journeys. The nurse who would administer Kate's chemotherapy was named Beth, a woman in her 50s with gentle hands and a warm smile. She explained each medication as she prepared the 4 bags, describing what Kate might feel and what to watch for in terms of side effects. Beth had been working in oncology for 15 years and had a calm, competent manner that immediately made Kate feel safer. As the first medications began flowing into Kate's bloodstream, she felt a strange mix of hope and surrender. These powerful chemicals would hopefully destroy the cancer cells growing inside her, but they would also challenge her healthy cells and make her feel sick for months. It was a terrible trade-off, but it was the path forward, the only way to get her life back. David sat beside her chair, occasionally reading aloud from a book or showing her funny videos on his phone. Other patients around them were dealing with their treatment in different ways, some slept, some read, some talked quietly with family members or friends. Kate was struck by the ordinariness of it all, how something so significant could happen in such a normal-seeming place. By the end of the 6-hour session, Kate was tired but felt surprisingly okay. The anti-nausea medications were working well, and she hadn't experienced any immediate side effects. Beth reminded her that the next few days might be more challenging as the medications built up in her system, but Kate left the cancer center feeling cautiously optimistic. That night, Kate and David ordered takeout from her favorite Thai restaurant and watched a comedy movie, trying to maintain some sense of normalcy. Kate felt different somehow, knowing that poison and medicine were circulating through her bloodstream, doing battle with cancer cells she couldn't see or feel. It was strange to think that her body had become a battlefield, that her recovery depended on chemicals destroying parts of her to save the whole. 3 days after her first chemotherapy session, Kate woke up feeling like she had been hit by a truck. The fatigue was unlike anything she had ever experienced, not the tiredness that comes from a long day at work or a poor night's sleep, but a bone-deep exhaustion that made even simple movements feel monumental. Getting out of bed required genuine effort, and the short walk to the bathroom left her breathless. The nausea came in waves throughout the day, despite the anti-nausea medications Dr. Martinez had prescribed. Kate found herself unable to tolerate the smell of coffee, which had always been her morning ritual, or the scent of the lavender candles she normally loved. Even the taste of water seemed strange and metallic. David hovered nearby, offering different foods and drinks, desperate to find something that would stay down. By the end of the first week, Kate's hair began falling out in clumps. She had prepared herself intellectually for this side effect, but the reality was still shocking. Strands came away in her hands when she ran her fingers through it, and her pillow was covered with dark hair each morning. The hair loss wasn't painful, but it was a constant reminder of what the chemotherapy was doing to her body. Kate made the difficult decision to shave her head before the hair loss became too patchy and uneven. David helped her, using clippers in their bathroom while Kate tried not to cry. Watching years of growth fall to the floor in minutes was more emotional than she had anticipated. When it was done, Kate stared at her reflection, barely recognizing the pale, bald woman looking back at her. The physical changes were challenging, but the emotional impact was even more difficult to navigate. Kate had always prided herself on her independence and competence, but now she needed help with basic tasks that had never required thought. Some days she was too tired to shower, too nauseous to eat, too weak to drive herself anywhere. The loss of autonomy was almost as hard to accept as the cancer itself. Work became increasingly difficult as Kate's treatment progressed. Even on her better days, her concentration was poor and her energy levels unpredictable. She tried to maintain her normal schedule, attending meetings via video call when possible, but found herself struggling to keep up with projects that had once been routine. Her brain felt foggy, as if there was a layer of cotton between her thoughts and her ability to express them clearly. Jennifer was understanding and encouraged Kate to take as much time off as she needed, but Kate resisted giving up completely. Her career had been such a central part of her identity for so long that stepping away felt like losing another piece of herself. She continued working part-time from home, though many days she accomplished little more than responding to emails and attending essential meetings. The relationship between Kate and David faced new stresses as her treatment continued. David tried to be supportive and positive, but Kate could see the toll it was taking on him. He was working longer hours to make up for the time he spent at medical appointments with her, and he rarely went out with friends anymore. Their conversations increasingly revolved around doctor's appointments, test results, and side effects, leaving little room for the easy intimacy they had once shared. Kate struggled with feeling like a burden. She watched David doing laundry, grocery shopping, and cleaning the house while also managing his demanding legal practice. When she tried to help, she often became exhausted quickly or felt too sick to finish what she had started. The guilt of being dependent on someone else was a constant weight on her shoulders. Their romantic relationship changed dramatically as well. Kate's body felt foreign to her, weakened and changed by treatment. The medications affected her skin, making it dry and sensitive. She lost weight rapidly and developed mouth sores that made eating and kissing painful. The physical intimacy that had been natural and easy became complicated by Kate's changed relationship with her own body. Kate's second chemotherapy session was more difficult than the first. Her body seemed more sensitive to the medications, and the side effects hit harder and lasted longer. The anti-nausea drugs were less effective, leaving her unable to eat for several days. She lost 10 pounds in 2 weeks, something that concerned Dr. Martinez enough to suggest supplemental nutrition drinks and closer monitoring. The oncology team introduced Kate to other resources at the cancer center. She met with a social worker who specialized in helping patients navigate the emotional challenges of treatment. There was also a nutritionist who helped Kate develop strategies for maintaining her weight and getting adequate nutrition despite the nausea and taste changes caused by chemotherapy. Kate was initially resistant to joining a support group, feeling like her problems were private and that talking to strangers wouldn't help. But, after a particularly difficult week when she felt completely isolated in her experience, she agreed to attend a meeting for young adults with cancer. The group met weekly in a conference room at the hospital, and Kate was surprised to find 8 other people around her age dealing with various types of cancer. The support group meetings became an unexpected source of strength for Kate. There was Sarah, a teacher with breast cancer who continued working through treatment because teaching gave her purpose. There was Marcus, a software engineer with testicular cancer who used humor to cope with his fear. There was Elena, a graduate student with leukemia who had postponed her wedding but was planning an elaborate celebration for after treatment ended. Listening to other people's stories helped Kate realize that there was no right way to have cancer or to undergo treatment. Some people in the group had maintained their normal routines as much as possible, while others had taken extended breaks from work and social obligations. Some had told everyone about their diagnosis immediately, while others, like Kate, had kept the information private initially. The diversity of approaches was reassuring and gave Kate permission to handle her own experience in whatever way felt right for her. As spring turned to summer, Kate's world contracted significantly. Her energy levels remained low, and she spent most days at home, either sleeping or trying to rest on the couch. She started binge-watching television series that she had never had time for before, finding comfort in fictional stories that were completely separate from her medical reality. Reading became difficult due to concentration problems, but she discovered audiobooks and spent hours listening to novels and memoirs. The isolation was sometimes overwhelming. Many of Kate's friends didn't know how to relate to her new situation, and social invitations became rare. People seemed to assume she wouldn't want to participate in normal activities, or perhaps they didn't want to be around someone whose illness reminded them of their own mortality. Kate understood their discomfort but still felt hurt by the distance that developed in some of her relationships. Emma's wedding was approaching, and Kate was determined to participate despite her ongoing treatment. The dress she had chosen months earlier no longer fit her changed body, and finding a replacement that would accommodate her weight loss and the port that had been installed in her chest for chemotherapy proved challenging. Emma was constantly worried about whether Kate would be well enough to fulfill her maid of honor duties, which added another layer of stress to an already emotional time. Kate's parents finally visited during her third month of treatment. Seeing their daughter bald and thin was clearly shocking for them, though they tried to hide their distress. Her mother immediately went into caretaking mode, cooking elaborate meals that Kate couldn't eat and rearranging furniture to make the house more comfortable. Her father, normally reserved with emotions, broke down crying the first night they were there, overwhelmed by the reality of his daughter's illness. The visit was both comforting and exhausting for Kate. Having her parents there provided emotional support and practical help, but it also meant being constantly observed and fussed over. She felt pressure to appear stronger and more positive than she actually felt, not wanting to worry them more than necessary. When they left after 2 weeks, Kate was relieved but also felt more alone than before. By her fourth chemotherapy session, Kate had developed a routine for managing the treatment cycles. She knew to expect 3 or 4 days of severe fatigue and nausea following each session, followed by a gradual improvement until the next treatment. She learned to schedule important activities during her better weeks and to rest completely during the worst days. The predictability helped her feel more in control, even though the overall experience remained challenging. Kate's hair slowly began growing back between treatments, appearing as a soft fuzz that was completely different in texture and color from her original hair. She experimented with different scarves and hats, sometimes feeling confident about her new look and other times feeling self-conscious about her appearance. Looking in mirrors remained difficult, as her reflection still seemed to belong to someone else. The medical team remained cautiously optimistic about Kate's progress. Her blood work showed that the chemotherapy was effectively reducing the cancer markers, and periodic scans indicated that the tumors were shrinking. Dr. Martinez explained that Kate was responding well to treatment, but emphasized that completing the full course of chemotherapy was essential for the best long-term outcome. Kate found herself thinking constantly about the future in ways she never had before. Previously, she had assumed she would have decades to accomplish her goals, to travel, to have children, to build the life she wanted. Now, every plan felt tentative and precious. She made lists of things she wanted to do when treatment was over, places she wanted to visit, experiences she wanted to have. The cancer had taken away her sense of unlimited time, but it had also clarified what truly mattered to her. The halfway point of treatment felt like a significant milestone. Kate had completed 3 of her 6 chemotherapy cycles, and the end was finally visible, even if it still seemed far away. She celebrated by going out to dinner with David for the first time in months, choosing a restaurant with outdoor seating where she felt less concerned about being around crowds of people. The food tasted better than anything had in weeks, and, for a few hours, Kate felt like herself again. David surprised her that evening with a small gift, a journal where she could write about her experience if she wanted to. He had noticed that Kate often seemed to be processing thoughts and emotions that she didn't always express out loud, and he thought writing might help her work through some of the complexity of what she was experiencing. Kate was touched by his thoughtfulness and his understanding of her internal struggles. That night, Kate wrote her first journal entry, describing the strange parallel universe she felt she was living in. There was her old life, where she had been healthy and busy and focused on career advancement and weekend plans. And there was this new life, where medical appointments dominated her calendar and every day was measured by energy levels and side effects. She wrote about missing her old self while also discovering unexpected strengths in her new reality. As Kate approached the second half of her treatment, she realized that surviving cancer was not just about the medical aspects of fighting disease. It was about learning to live with uncertainty, about finding meaning in small moments, about accepting help from others, and about discovering what really mattered when everything familiar was stripped away. The journey was far from over, but she was beginning to understand that the person who emerged from this experience would be forever changed, hopefully for the better. Emma's wedding day arrived in late July, during the week between Kate's fourth and fifth chemotherapy sessions. Kate had been looking forward to this day for months, not just because she wanted to see her sister get married, but because it represented a return to normal life activities that cancer had stolen from her. She had managed to find a beautiful dress that fit her changed body and had worked with a makeup artist who specialized in helping cancer patients feel confident about their appearance. The morning of the wedding, Kate woke up feeling better than she had in weeks. Her energy levels were higher, and the nausea that usually plagued her was minimal. She took this as a good sign and threw herself into the preparations with enthusiasm. David helped her get ready, carefully adjusting her wig and making sure her makeup covered the pale exhaustion that still lingered around her eyes. At the church, Kate was overwhelmed by the outpouring of love and support from family and friends she hadn't seen in months. Many people were shocked by her changed appearance, but they tried to hide their surprise behind bright smiles and enthusiastic hugs. Kate found herself comforting others who were emotional about her situation, which was both exhausting and strangely empowering. Walking down the aisle as Emma's maid of honor was one of the most meaningful moments of Kate's cancer journey. The simple act of participating in this important family milestone made her feel connected to her old life and hopeful about her future. She managed to get through the ceremony without feeling faint or sick, though she had to sit down during the reception when the fatigue caught up with her. Emma looked radiant in her wedding dress, and Kate was struck by how young and hopeful her sister seemed. There was something poignant about witnessing this celebration of new beginnings while she was fighting for her own future. During her maid of honor speech, Kate spoke about the importance of cherishing every moment and not taking health or happiness for granted. Her words carried a weight that they wouldn't have had before her diagnosis. The wedding photographer captured many beautiful images of Kate with her family, and looking at them later, she was surprised to see that she looked stronger and happier than she felt. The wig was convincing, and the makeup had given her back some color and definition. More importantly, the joy in her eyes was genuine, a reminder that cancer hadn't taken away her ability to experience happiness and love. After the wedding, Kate returned to Denver feeling emotionally recharged but physically depleted. The travel and excitement had taken a toll, and she spent the next few days recovering before her fifth chemotherapy session. David was increasingly worried about her weight loss and the cumulative effects of treatment, but Kate was determined to complete the full course of chemotherapy as planned. The fifth treatment hit her harder than any of the previous ones. Her body seemed to be reaching its limit for tolerating the toxic medications, and she developed new side effects including severe mouth sores and peripheral neuropathy that made her fingers and toes feel numb and tingling. Dr. Martinez discussed the possibility of reducing the dosage for the final treatment, but Kate insisted on completing the full protocol. During this difficult period, Kate received an unexpected visitor. Her college roommate Jessica, who lived in California, flew to Denver for a surprise weekend visit. Jessica had been one of Kate's closest friends, but they had lost touch over the years as careers and distance created barriers to regular communication. Learning about Kate's cancer diagnosis through mutual friends had prompted Jessica to reach out and offer support. Jessica's visit was exactly what Kate needed. Unlike many people in Kate's life, Jessica wasn't afraid to talk honestly about the cancer or to acknowledge how hard the experience was. She didn't try to maintain false optimism or avoid difficult topics. Instead, she brought a sense of normalcy and humor that had been missing from Kate's life for months. They spent the weekend watching old movies, ordering takeout from restaurants Kate hadn't been able to tolerate in months, and talking about everything except cancer. Jessica shared stories about her own challenges with infertility and divorce, reminding Kate that everyone faces difficult periods that test their strength and resilience. The conversation helped Kate feel less isolated in her struggle. Jessica also brought a different perspective on Kate's relationship with David. She observed that while David was clearly devoted and caring, the stress of Kate's illness was affecting their dynamic in ways that might need attention once treatment was over. Kate had been so focused on getting through each day that she hadn't considered the long-term impact of cancer on their relationship, but Jessica's comments made her think about what rebuilding their life together might require. As Kate entered her final month of treatment, she began to experience what her oncology team called scanxiety, the intense nervousness that comes with waiting for test results that will determine whether treatment has been successful. The PET scan that would show whether the cancer was completely gone was scheduled for 2 weeks after her final chemotherapy session, and those 2 weeks felt like the longest of Kate's life. Dr. Martinez had prepared Kate for the possibility that some cancer cells might remain after chemotherapy, which could require additional treatment such as radiation therapy. Kate tried to stay positive, but the uncertainty was agonizing. She had endured 6 months of feeling sick and exhausted, and the thought that it might not be enough was almost unbearable. The final chemotherapy session was both celebratory and anticlimactic. The nursing staff at the cancer center had become like family to Kate over the months, and they marked the milestone with flowers and congratulations. Beth, Kate's primary infusion nurse, gave her a small bell to ring when she was ready, continuing the tradition that Kate had noticed on her first visit to the oncology center. Ringing the bell was an emotional moment that Kate hadn't fully prepared for. Standing in the infusion center where she had spent so many difficult hours, surrounded by other patients who were still fighting their own battles, Kate felt a complex mixture of relief, gratitude, fear, and hope. The sound of the bell represented the end of one chapter, but the beginning of another uncertain phase of waiting and hoping for good news. David took a week off work to help Kate through the final recovery period and to be present for the crucial scan results. Kate's parents also returned to Denver, and Emma and her new husband drove up from Colorado Springs. Having the whole family together created a supportive environment, but it also increased the pressure Kate felt to receive good news. The 2 weeks between Kate's final treatment and her follow-up scan passed slowly. Kate experienced a strange combination of relief and anxiety. Her body began to recover from the immediate effects of chemotherapy, her energy levels improved slightly, her appetite returned, and the nausea subsided. But the fear of what the scan might show overshadowed these improvements. Kate used this time to reconnect with aspects of her life that had been on hold during treatment. She returned to work part-time, though she found that her priorities and perspective had shifted dramatically. Projects that had once seemed urgent now felt less important, and she struggled to care about marketing campaigns and client presentations with the same intensity she had before. She also began to think seriously about what she wanted her life to look like going forward. The possibility that cancer might return someday was something she would always live with, and this awareness changed how she wanted to spend her time. Kate started researching volunteer opportunities at the cancer center, thinking that her experience might be valuable in helping other patients navigate their own journeys. The night before her scan appointment, Kate couldn't sleep. She wandered through her house, looking at all the familiar objects that had remained constant while her life was turned upside down. The books on her shelves, the photos of happier times, the kitchen where she hoped to cook full meals again soon. Everything looked the same, but Kate knew that she was fundamentally different from the person who had lived in this house before cancer. David found her sitting in their backyard again, just as he had the night before her first chemotherapy session. This time, though, Kate wasn't crying or expressing fear. She was thinking about the future and all the possibilities it might hold. Win or lose, she had proven to herself that she was stronger than she had ever imagined. The cancer had taken away many things, but it had also given her a clarity about what truly mattered that she never would have achieved otherwise. The morning of the scan, Kate felt surprisingly calm. She had done everything she could do, endured everything she needed to endure. The results would show what they would show, and she would face whatever came next with the same determination that had carried her through the previous 6 months. David drove her to the hospital, and they sat quietly in the car for a few minutes before going inside. The scan itself was routine after all the medical procedures Kate had undergone during treatment. She lay still while the machine captured images of her internal organs, looking for any remaining signs of cancer. The technician, as always, couldn't discuss what the images showed, which meant another period of waiting for Dr. Martinez to review the results and schedule an appointment to discuss them. 3 days later, Kate sat in Dr. Martinez's office with David beside her, waiting to learn whether 6 months of chemotherapy had been successful. Dr. Martinez entered the room with a smile that immediately told Kate everything she needed to know. The scan showed no evidence of active cancer. The treatment had worked. Kate was officially in remission. The relief was overwhelming, but it was accompanied by a complex mix of emotions Kate hadn't anticipated. Along with gratitude and joy, she felt a strange sense of loss. The intensity of fighting cancer had given her life a clear purpose and meaning that was now gone. She also felt survivor's guilt, thinking about other patients from her support group who hadn't been as fortunate. Dr. Martinez explained that being in remission was excellent news, but that Kate would need regular monitoring for several years to ensure the cancer didn't return. She would have scans every 3 months initially, then less frequently as time passed. The anxiety of waiting for test results would be a permanent part of Kate's life, but the immediate crisis was over. That evening, Kate and David celebrated quietly at home with takeout from their favorite restaurant. Kate's parents called with tears of joy, and Emma sent a bouquet of flowers with a note saying she had never been prouder of her big sister. The support network that had carried Kate through treatment was sharing in her victory, and their happiness was almost as meaningful as the good news itself. As Kate prepared for bed that night, she looked at herself in the bathroom mirror. Her hair was growing back in soft curls that were completely different from her original straight hair. Her face was still thinner than before, and her body bore the subtle marks of what she had endured. But her eyes were bright with hope and determination. She had survived, and now she had to learn how to live again. 2 years after her final chemotherapy treatment, Kate Matthews sat at her kitchen table on her 34th birthday, staring at the untouched cake David had surprised her with earlier that morning. The house was quiet, David was at work, her parents had called with birthday wishes, and Emma had sent a care package filled with Kate's favorite tea and homemade cookies. But, for the first time since her diagnosis, Kate felt ready to break the silence she had maintained about her cancer journey. The past 2 years of remission had been a complex process of rebuilding and redefining her life. The transition from patient to survivor was not as straightforward as Kate had expected. While she was grateful to be healthy, she struggled with what psychologists call re-entry syndrome, the difficulty of returning to normal life after a traumatic experience that fundamentally changes your perspective. Kate's relationship with work had never fully recovered. Although she had returned to her marketing director position, she found it increasingly difficult to care about campaigns and client presentations with the same intensity she had before cancer. The urgent deadlines and office politics that had once driven her felt trivial in comparison to the life and death battles she had witnessed in the cancer center. After much consideration, Kate had made the difficult decision to leave her corporate job and pursue work that felt more meaningful. 6 months earlier, Kate had started working as a patient advocate at the same cancer center where she had received treatment. Her role involved helping newly diagnosed patients navigate the complex medical system, understand their treatment options, and access resources for emotional and practical support. Using her own experience to help others facing similar challenges gave Kate a sense of purpose that her previous career had never provided. The work was emotionally demanding but deeply fulfilling. Kate found that her perspective as someone who had walked the same path was invaluable in connecting with frightened patients and their families. She could speak honestly about the challenges of treatment while offering hope based on her own successful outcome. Some days were harder than others, particularly when she worked with patients whose cancers were more advanced or aggressive than hers had been. Kate's relationship with David had also undergone significant changes during her recovery period. While their love for each other had never been in question, the stress of cancer treatment had revealed differences in how they coped with crisis and uncertainty. David's tendency to focus on practical solutions had been helpful during the acute phase of Kate's illness, but it sometimes left little room for processing the emotional impact of their shared trauma. They had started couples counseling about a year into Kate's remission, working with a therapist who specialized in helping relationships survive serious illness. The sessions had been challenging but productive, helping them understand how cancer had affected not just Kate but both of them. David had to process his own fears about potentially losing Kate, his feelings of helplessness during her treatment, and his struggle to support her while managing his own career and emotional needs. Through counseling, Kate and David learned to communicate more openly about their ongoing fears and needs. Kate realized that her tendency to protect others from her emotional struggles had sometimes shut David out when he wanted to help. David recognized that his focus on staying positive and moving forward sometimes dismissed Kate's need to process the ongoing psychological effects of her cancer experience. Their physical relationship had also required patience and rebuilding. Kate's body had changed during treatment, and even 2 years later, some of those changes persisted. She had developed chronic fatigue that flared up unpredictably, and the peripheral neuropathy in her hands and feet had never completely resolved. More significantly, the psychological impact of having her body feel foreign and unreliable during treatment had affected her comfort with physical intimacy. With time, patience, and open communication, Kate and David had gradually rebuilt their physical connection. Kate learned to advocate for her needs and limitations without feeling guilty or broken. David learned to approach intimacy with sensitivity to Kate's changed relationship with her body. Their sexual relationship looked different than it had before cancer, but it was built on a deeper understanding of each other's vulnerabilities and strengths. Kate's hair had grown back completely, though in a different texture and with more gray than before. She had initially been self-conscious about the gray, but eventually decided to embrace it as a visible reminder of what she had survived. Her body weight had stabilized, though she remained thinner than before treatment. Most importantly, her energy levels had gradually improved, allowing her to return to activities she loved, including hiking and yoga. The social relationships that had been strained during Kate's treatment had mostly healed, though some had never fully recovered. Kate learned to forgive friends who had been unable to cope with her illness, understanding that cancer forces everyone to confront their own mortality in uncomfortable ways. She also learned to value the friends who had shown up consistently, even when supporting her was difficult or inconvenient. Kate's family relationships had deepened through the shared experience of facing her cancer together. Her parents had become more involved in her life, calling weekly and visiting several times a year. Emma and Kate had grown closer, with Emma often saying that watching her sister fight cancer had taught her not to take anything for granted. The wedding that had occurred during Kate's treatment had become a symbol of life continuing and love persisting even in the face of serious challenges. The support group Kate had joined during treatment remained an important part of her life. Several members had become close friends, bonded by their shared understanding of what it meant to face mortality at a young age. They celebrated each other's milestones, clear scans, treatment completions, weddings, births, and career changes. They also supported each other through setbacks, recurrences, and losses that were an inevitable part of the cancer community. Kate had also become involved in fundraising and advocacy for cancer research and patient support services. She participated in charity walks, spoke at fundraising events, and lobbied for legislation to improve insurance coverage for cancer treatments. These activities gave her a way to channel her gratitude for surviving into action that might help others facing similar challenges. The quarterly scans that monitored Kate for cancer recurrence had gradually become less anxiety-provoking, though they never became routine. Kate had learned coping strategies for managing anxiety, the intense nervousness that preceded each scan. She practiced meditation, maintained regular exercise, and relied on her support network to help her through the days of waiting for results. 2 years into remission, Kate's scans continued to show no evidence of disease, and Dr. Martinez had begun spacing them out to every 6 months. Each clear scan felt like a gift, a reprieve that allowed Kate to plan further into the future. She had learned to celebrate these milestones while also accepting that the possibility of recurrence would always be part of her reality. The emotional work of surviving cancer had been ongoing throughout Kate's remission. She had continued individual therapy to process the trauma of her diagnosis and treatment, the grief for her former self, and the anxiety about potential recurrence. Kate learned that surviving cancer wasn't just about the physical recovery, it was about integrating the experience into her identity and finding meaning in what she had endured. Kate had started writing about her experience, initially just for herself as a way of processing her thoughts and emotions. The journal that David had given her during treatment had grown into multiple notebooks filled with reflections on illness, recovery, relationships, and personal growth. Some friends had encouraged her to share her writing more widely, suggesting that her perspective might help other cancer patients and survivors. On this birthday morning, as Kate sat with her untouched cake and looked back over the past 2 years, she felt ready to share her story publicly for the first time. She had been largely silent about her cancer experience, sharing details only with close family and friends and the patients she worked with professionally. But she was beginning to understand that her story might have value beyond her immediate circle. Kate opened her laptop and began to write, not in her private journal but in a document she intended to share. She wrote about the fear and uncertainty of diagnosis, the physical and emotional challenges of treatment, the complexity of relationships during crisis, and the ongoing process of rebuilding life after cancer. She wrote about the ways that surviving cancer had changed her priorities, her relationships, and her understanding of what truly matters in life. As she wrote, Kate realized that breaking her silence wasn't just about helping others who might face similar challenges. It was also about honoring her own journey, acknowledging the person she had become through surviving cancer, and celebrating the life she had fought so hard to preserve. The woman writing at the kitchen table was different from the woman who had received a cancer diagnosis 2.5 years earlier, and both versions deserved recognition and respect. Kate wrote about the small victories that had marked her recovery, the first time she could taste food normally after chemotherapy, the day her hair had grown long enough to style, the morning she woke up and realized she hadn't thought about cancer for an entire day. She wrote about the ongoing challenges too, the fatigue that still flared unexpectedly, the anxiety before medical appointments, the way that cancer had changed her relationship with her own body and her plans for the future. She wrote about gratitude, for the medical team that had saved her life, for the family and friends who had supported her, for David's unwavering presence, for the other cancer patients who had shared their wisdom and strength. But she also wrote about the parts of cancer survivorship that people don't often discuss, the guilt about surviving when others don't, the frustration with people who assume that remission means everything is back to normal, the ongoing fear that lives quietly in the background of daily life. As the afternoon sun streamed through the kitchen windows, Kate realized she had been writing for hours. She had filled several pages with thoughts and memories that she had never organized so clearly before. Reading back over what she had written, Kate felt a sense of completion and purpose that had been missing from her life. That evening, when David came home from work, he found Kate still at the kitchen table, now eating a slice of her birthday cake while continuing to write. She looked up at him with bright eyes and told him about her decision to share her story. David's face lit up with pride and understanding. He had watched Kate struggle with how much of her experience to keep private and how much to share, and he recognized this as an important step in her ongoing recovery. Kate spent the following weeks refining her writing, adding details and reflections that captured the full complexity of her cancer journey. She wrote about the practical challenges, navigating insurance, managing side effects, communicating with employers, that might help other patients prepare for their own experiences. She also wrote about the emotional and spiritual growth that had emerged from facing mortality at a young age. When Kate finally shared her story publicly through a blog post and later through speaking engagements, the response was overwhelming. Other cancer patients and survivors reached out to thank her for putting into words experiences they had struggled to express. Family members of cancer patients contacted her for advice on how to support their loved ones. Healthcare professionals asked her to speak to their teams about the patient perspective on cancer care. Kate's birthday had become the anniversary not just of her birth, but of her decision to transform her private struggle into a public resource for others facing similar challenges. Breaking her silence had been scary, but it had also been liberating. By sharing her story, Kate had given meaning to her suffering and turned her survival into a tool for helping others. Looking back now, Kate understood that cancer had taken many things from her: her sense of invincibility, her carefully planned future, her naive assumption that serious illness happened to other people. But it had also given her gifts she never could have anticipated: a deeper appreciation for ordinary moments, stronger relationships built on authentic vulnerability, a career that felt genuinely meaningful, and a sense of resilience that would serve her well no matter what challenges the future might bring. As Kate blew out the candles on her birthday cake, now properly celebrated, she made a wish not for perfect health or a guarantee against future illness, but for the continued strength to face whatever came next with grace, honesty, and hope. She had learned that survival wasn't just about living through cancer, it was about learning to live fully and authentically in the knowledge that life is both fragile and precious, and that sharing our stories of struggle and resilience can light the way for others walking similar paths.